You might not know it, but America has a gigantic problem with electronic health records. There are a bunch of different companies in this industry, and their software just isn't compatible. It's not an accident. It's by design. The lack of interoperability makes it harder for hospitals to switch to a competitor. But it also makes these records a lot less useful. This industry is suddenly in the news because of Epic Systems. That's a privately held company that's a major player in the space. As CNBC's own, and she's terrific, CNBC.com's Christina Farr reported, Epic CEO has been writing to her hospital customers to convince them to oppose some new legislation that's designed to make it easier to share medical information. Epic wants these systems to stay balkanized. Now, in response to that story, Joe Kiani, he's the founder and chairman and CEO of Masimo. That's a medical technology company that makes non-invasive monitoring systems, actually reached out to us. He thinks what Epic's doing is indefensible. I wanted to give him a chance to explain. Mr. Kiani, welcome back to Mad Money.
Hello, Jim. Good to be back.
Okay, you are ingrained inventor. You have tons of patents. You have done a lot more to be able to make it so you're safe when you're in a hospital. Why are you opposing something that could impinge on people's privacy?
Well, look, privacy rules were there to protect patients, not to potentially harm them. Patients should make the trade-off between what's more important, privacy, or having their data available in a way that can hopefully save their lives. And that also, unfortunately, assumes that data privacy can't be kept. There's a lot of great companies that do a great job of making sure data can be transmitted in a way that keeps patients' data private and confidential.
Would the healthcare system not save maybe hundreds of billions of dollars over time if we actually knew what the statistics were and had the algorithms, the Amazon Web Service data, so to speak, of everybody in our country without knowing their names?
Yeah, exactly. We can get data from a hospital with a random number that's assigned to a patient, and only the hospital has knowledge about who that number is associated with. So while you could hack into anything, it's like saying no one should own a phone or a computer because someone could hack into it. But there is protection, and what's more important is by sharing data, patients' lives can be saved.
So give us some examples of patients' lives that could be saved so that people don't think this is just abstract.
Well, we make pulse oximeters. When people are on opioids using infusion pumps, these infusion pumps can sometimes administer too much opioids. If we hoarded our data and said our pulse oximeter data cannot be input into the infusion pump, then when the patient's overdosing and our pulse oximeter is dropping like a lead from 100 to about 80, 70, 60, that data doesn't get to the infusion pump, and the infusion pump does not shut down the flow of opioids. That's a real-life example of why data sharing is important today.
All right, if I am let's say, a leader like Judy Faulkner, who privately owns Epic, it would be a possibility if you had that interoperability. She believes it would compromise patients. I'd love to have her on, by the way, privacy. But at the same time, doesn't it just preserve her incumbency?
Well, I've learned a long time ago to not question people's motives, but I can tell you, we used to be in the business of hoarding our data. But what we realized is that patients were getting harmed because we were hoarding data. There's an example right near your home. A boy, 13-year-old, Rory Staunton. He goes to the gym like we all did, falls in the gym, gets a little scratch on his elbow. His own bacteria from his skin gets inside his bloodstream. Now he goes home, feels bad, throwing up, feeling a leg ache. They take him to his physician, and for a kid his size, his heart rate was really high. They still send that kid home thinking it could be a stomach flu or something bad he ate. He gets so bad, his parents take him to the emergency department. They do blood draw. And unfortunately, his white blood cell count was really high. They still send him home. Now, a few hours later, that boy died. Now, imagine at that time, both the blood lab machines, the patient monitors that measured the heart rate, all were interoperable, all could share data. Algorithms could have seen, look, high white blood cell count, high heart rate for his size, that could mean sepsis. and they could have treated them for sepsis, and Rory would probably be alive here with us today.
Do you think, Joe, that if people knew the trade-off, that it might mean life or death, for them to not have any information themselves exposed personally, wouldn't they choose life?
Absolutely. I know I would. And you know what? I'm today running a medical technology company, but sooner or later, I'm going to be a patient. So while I'm sitting in my role as CEO of my company, I made a pledge to share my data. And so did 90 other companies over the last 8 years. Unfortunately, Epic hasn't. And I have to commend HHS Secretary Azar and ONC Director Don Rucker for now finally saying enough is enough. You guys have to share the data in a way that it's secure, it's safe, and it's not burdensome cost-wise.
Well, great. I'm sorry, go ahead.
Well, I was just going to say, imagine Epic was making refrigerators, hospitals were apartment buildings, and patients were people in apartments with their refrigerators. Now, what Epic is saying, the food you put in that refrigerator, the hospital can use it, Epic can use it, but you know what? The patient, I'm not sure you can use it, and nobody else can use it. Now, add to that, by the way, those refrigerators were paid by the public, by us, tax holders, who paid for it. And I think finally people are saying enough is enough. It's time to share the data.
I totally agree. It's completely absurd. I'm glad you came in this position. It's been our position for a long time, and I really appreciate you coming on. You also have a dynamite company, just pre-announced some really good numbers. I didn't want to don't bury that lead too much. That's Joe Kiani, Chairman and CEO of Masimo. Great job, sir. Great to have you on the show.
Thank you so much. Thanks for having me, Jim.
Mad Money's back after the break.
Don't miss a second of Mad Money. Follow @Jim Cramer on Twitter. Have a question? Tweet Cramer. #MadTweets. Send Jim an email to madmoney@cnbc.com or give us a call at 1-800-743-CNBC. Miss something? Head to madmoney.cnbc.com.